So we've been exploring whether an infusion of umbilical cord blood could improve symptoms of autism in young children with autism. And we first performed an open label phase 1 study in 25 children who were infused with autologous cord blood and evaluated at 6 and 12 months post-infusion. And in that group of children, eligibility was 2 to 6 years of age, and children could not have a known genetic cause of autism, and they were screened as part of the study for Fragile X and by microarray, and children had abnormalities on those tests were not eligible. Children also had to have a qualified autologous cord blood unit that had been banked when they were born, and we enrolled 25 children. They had varying nonverbal IQs ranging from the low 30s to the mid 120s, with normal being around 100. So some of the children on the study were intellectually disabled, which is a comorbidity of autism, and which is defined as having a nonverbal IQ less than 70. The median IQ of the group was about 64. We gave these children a single infusion of their autologous cord blood, and we observed for safety and feasibility, and then we explored potential endpoints that could be used in subsequent studies. We found that the children tolerated the infusions well, and that there were no adverse events related with the infusion of their autologous cord blood. We studied endpoints that included parent-reported behavioral outcomes like the Vineland socialization scale or the Vineland communication scale, as well as some clinician-rated behavioral outcomes like the CGI, and some neurophysiologic and neuroimaging outcomes, which included eye tracking, EEG, and MRI. And again, this was an open label safety study, so the results for efficacy were all descriptive. We did find that in the children, particularly without intellectual disability, meaning a nonverbal IQ over 70, that there was an improvement at 6 months in the Vineland socialization scale and the communication scales, and that was sustained in the children who improved at 12 months. We also saw correlates with improvement in eye tracking, and we're still studying the MRI. And finally, we saw improvements in EEG power. So from the results of that study, we designed a randomized phase 2 placebo-controlled crossover trial testing cord blood versus placebo in 180 children. And we defined the Vineland socialization scale as the primary endpoint, and then had multiple secondary endpoints, which included the eye tracking, the EEG, the CGI, and a few other clinician-rated behavioral outcomes, and the Vineland communication scale. We intended to enroll children with nonverbal IQ over 70, and we screened children for eligibility remotely using IQ testing done locally as the screen for study eligibility. We then retested children with IQ testing on site at Duke, but we didn't use that testing for eligibility. At the end of the day, although we intended for at least 143 of the children to have a nonverbal IQ over 70, only 101 of the children achieved that goal. And so our study was underpowered for some of the analyses we planned to do. And for all study patients, there was no statistically significant benefit of cord blood on the primary endpoint, which was the Vineland socialization scale. But when we looked at the subgroup of kids who had a nonverbal IQ over 70, even though we were underpowered, we saw a trend to improvement in the Vineland socialization scale, and we saw statistically significant improvements in some of the secondary endpoints, which included the Vineland communication scale, the EEG, and eye tracking, which is a measure of executive function. So from that study, we made interesting observations. We had design issues that really compromised our ability to answer the question we intended to answer. I didn't say it before, but we also saw a huge placebo effect, particularly in the parent-reported outcomes and most commonly in the children with intellectual disabilities, so meaning nonverbal IQ under 70. And so from this, we cannot definitively conclude whether cord blood is beneficial in autism, but we do plan to do additional studies in the intended population, meaning kids with either nonverbal or full-scale IQs over 70. And those studies are planned but not scheduled yet.